Oh, we're going to tackle a difficult topic today, and I'm going to walk you through some ways to do it and show you a few things on screen. And I'm also going to have a really interesting guest myself. This is going to be fun. But the reason I did it that way is because I did do a bit of filming about it last year, but I was still really in chemo brain phase. And although I covered it very well, I wanted to show you with the actual hands on walkthrough. I think that's so helpful. Versus just telling you about it in some instances. So I decided to hold on to it and just do it this way. I think it's way good to actually see it for yourself. So I'm going to start with what qualifies me. Mm, Nothing. No, really. I probably looked at maybe 1,000 CVs in the US. We tend to say resume, but doctors use the curriculum vitae designation, and a lot of those are actually available. If you look around, if you really want to see your physician's information or your physician researcher's information, because a lot of them are. And in the US, of course, we operate on a few different, mm, I'll say, facility types. Let's just say we've got our academic institutions, we've got our private institutions, we've got private practices, public practices, but for the most part, they're all a fee for service kind of practice. So when it comes to choosing a provider, oh, then you've got your types of providers, your advanced practice provider, your MD, your DO, you've got your acronym salad, as I like to call it. So when it comes to choosing what's right for you, there are a number of different ways to go about it, and that can feel really overwhelming. So I'm going to give you a few ways to approach it. And some of them are just, hey, I just want to get this over with. How can I make this as simple as possible and get the hell out of this process? And then some of them are, hey, I really want to put some thought into this. How do I do it? Because it's just not that easy. I know it's so overwhelming. And I've read CVs of all types, of all origins, of all specialties, of all levels. So I thought maybe I could give you some direction at least to get you started. So let's what I'm going to do first is introduce myself and how I did it in a very short segment last year. And then we can take breaks and look at it, how it actually operates. Um, but I want to remind everyone that the first thing that comes to mind whenever we talk about picking a doctor is, that old dad joke, what's that thing that they call the person at the bottom of their graduating doctor class? What do they call her? Doctor. That's what it comes down to. And what everybody always asks for is, oh, they're the best, or oh, you got to go to my doctor. They're the best. They're the best. Well, what does that mean? That's the essential question. What does the best mean? What does it mean to you? What are you looking for? Are you wanting that doctor that's going to hold your hand, or do you want, the arrogant, psycho who does the best surgery in the whole area? It's different for everyone. But that's what you have to decide when you're going in. And then if you're a parent and you're picking for your child or for your own, parent, and you've got to help them. And there's definitely a generational gap in how we make these decisions. You know, People of a certain age, whatever their doctor says, whoever they say to go see, that's who they're going to. Doesn't matter if they're awful or not. So, there's definitely differences in how we do this. But I think today, in this age of information, really the postmodern age of information where the robots are picking for us, right? How do we do it? How do we still put our intelligence and our will into this? How do we override? Can we override the robots, the prior authorizations, the insurance company? Yeah, you can do that too. There are ways to do all of it. And there are ways to determine quality. You can't always know um, really what you're going to get until you do it. but there are ways. I look at it like dating in some ways. You talk to your friends, see what they have to say. Then you've got to look in the books at the profiles, whatever your insurance is offering you, right? That's kind of your first line of, hey, who's in here? Who's up for my option to choose from? And then you can always go from there. You've got your in network, out of network, and then if you've got to expand it, you can fight for that, or not fight for it, but delicately appeal for it and really try to get it, just like you would, like in a social situation. So there you have it. So we'll start a little bit with simple logistics. If you're in a larger city, some folks are just going to look for convenience. Do they have free parking? Is it easy to get to? Is it nearby? How difficult is it to get to this physician's office? And you've got access. Do I have to wait 3 weeks? Do I have to wait 3 years to get an appointment? It might be that simple. Does it make you suspicious if you don't have to wait 3 years? Right. But maybe you just got lucky. So some of those things are pretty basic, and they might be the things that make your decision. Depends on your condition, whether or not you can wait. So I'm going to go ahead. Hey, look at this one. The most difficult thing. Where do you start? What are you looking for? What is the task of the day? Is it a condition? Is it time for you to select your primary care physician who's going to coordinate everything? Who's available? How do you know if they're any good? Where do you even start with all this? Wow. It's been a really, it's just been a lot of change. I mean, back in the day, you lived in a small town, you kind of had your town doctor. We've got really cute TV shows about that. Today we have concierge care. We've got, all these different systems. Sometimes, they're assigned to you and then you can either change it yourself or just kind of roll with whoever they gave you and hope for the best, right? Oh, concierge care is something else. I'll get into that a little bit more as we go on, but primary care being such a challenge, we have such a shortage of primary care doctors, primary care access. So you've seen the rise in urgent care and telehealth for basic services, people you never meet, you have no relationship with, or you have these folks that are very small practice and their patient load is limited to, say, 300 patients maximum for existence. That was a slip of the tongue, wasn't it? Freud, party of one or two. I'm split in two right now. Oh, look at the hair. It just gave me such a giggle. That was pretty soon after chemo, but yeah, I've come a little bit of a ways. Right? But at the end of it all, you're still the one in charge of your care, and you've got to find somebody that you're comfortable with, that you trust, that is going to be in charge. You've also got to make sure that their office is organized and that they're going to get their stuff done because you're depending on it. Your health is depending on it. So how do you do it? Personally, I've never really found a tool that was that great at, like we've got, these find a doctor tools and these, review tools. You've got US News and World Report. You've got these local magazines with all the top doctors, all of those things. A lot of that is marketing. Very true. The best way, of course, is to go and meet a provider. A lot of them will offer appointments where you can go and meet with the provider before you but it's really hard to get in and spend your time, have pre-appointment. Some of them charge for that, some of them don't, but most of them do. And but everybody's busy, of course. But the fact of the matter is, when it comes to that kind of thing, especially when it's primary care, who has the time? Who has the I don't want to say inclination, because inclination is really wrong, especially if you've got chronic conditions you're trying to manage and you're basically choosing the center of your universe when it's like a primary care type of thing. Then you've got the list. Your insurance plan has a list to choose from. In that list, if you go into your insurance plan documents, they're going to have some patient reviews, they're going to have recommendations, but at least that kind of narrows your focus. Then we've got concierge care. Concierge primary care is another thing that might be something to consider, because say you've already picked your primary care doctor. Well, you also tend to find out that, hey, I'm sick, I've got the flu, I need to go in. Well, we'll see you in 4 or 5 days. Well, how does that help me? I'll be,
pretty far along. Maybe I'm better, maybe I'm a lot worse by then.
Every time I listen to that, I always think I could be dead by then. If you've got the flu. It's true. Or you could end up in the emergency department because the flu is actually pretty serious. And so it's probably, quite possible. But okay, so I want to give you a little bit of an idea of pricing on concierge primary care because you may not be aware. So concierge primary care at this month, like there's a national network. The MDVIP network is one I can call out. That is a national. I believe they're in every state, most major cities, and I talk about it in just a second here. Just the fact that you can't just be any doctor and join MDVIP. You have to be vetted. So I'm sure there are other networks or other concierge practices. And then there are some, now what I will say about that is you pay the fee for concierge primary care, and it is say like around $500 per quarter. And then, so that's every 3 months. So what, that's about 2,000 a year. And then you have your regular insurance covers your other care, your visits. Like if you have a sick visit or whatever, most insurance plans are accepted just like at a regular doctor's office. But what you don't have, like you have, access. It's not like on the TV show where they come to your house and what, I mean, that's available, I'm sure, if you're, at a certain level too. But I'm just talking about regular folks, what you might be able to afford. And for the sort of thing that you need. There's on the opposite end, there's something a program that you might like or may not like. You could go to a resident training program for primary care, and those tend to have a little bit more availability of appointments, but you will very much not likely see the same doctor because they rotate in and they're doing their primary care training. So there might be more availability of appointments. Your insurance is probably accepted and you'll probably get seen sooner, but you won't build a relationship with a physician. But they'll probably be almost overly cautious and want to do lots of different explorations and treatments and testing and that sort of thing because they're learning to be and they're going to be overseen by an attending and that sort of thing. So that might be another option that you might like and might actually have better access on the day-to-day basis as far as appointments go. Just depends on what you have available in your area. So there's two really opposite ends of the spectrum, but both have perhaps more access as far as appointments go, and both would serve families and as well as individuals. And the concierge would have more 24-hour types of and weekend access, and you can like really build that relationship with your. It's really good if you've got a chronic illness or a lot of needs, that sort of thing. If you have a lot of paperwork that needs doing, like we've talked about FMLA, of course, that might be a good thing for you versus just popping into a doctor you don't know and needing different things like that, or you have a lot of medications or conditions that need managed. I feel like it could be worth it if you can afford it to have a concierge primary care. That's just one opinion about it, but there are benefits to it. And with the primary care shortage not looking like it's going away anytime soon, if that's your situation, it's definitely worth considering.
How is that helpful? Well, that's where concierge care and concierge primary care has become a thing. And I can speak from experience on this. I've had concierge primary care for about a good 7 or 8 years now, and they're a little bit better about getting to know their patients because they have a limited patient load and they've been pre-screened to be quality providers. They have to be established and invited to come into those networks. And the good thing about that is you won't have those types of issues. You won't have the access issue. You'll get seen more, you'll be better known within the practice, and you won't have those types of delays in care. But and I should say they will be covered by your insurance pretty much, but you will have to pay extra, usually a quarterly fee or an annual fee, to have that type of extra care. But for someone like me who has these extra diagnoses and kind of some serious things going on, that's something that just works better for me. So I have opted to have that type of care in my world. So, but when it comes to actually choosing them, there's a new development in that world. Google. Is anybody really surprised? What's weird about it is, say a physician changes their employment or their practice location or something like that, then you'll go to look up a provider and it's like, oh, this provider is permanently closed. Well, that's a weird thing to see about a doctor, isn't it? But what you can see is actual Google reviews from patients. Now, that's about as reliable as, you know, going to a tire shop. You might see more negative ones, people who are more fired up, let's say, that maybe they didn't have a great experience, but you'll see some positive reviews too. But it also lets you know that these doctors are now, or maybe the system that they work for, are soliciting for those reviews. So it's way more marketing oriented.
That's the other thing too, is they can manage the reviews, and they can hire a company to manage the reviews that are on Google, just like you could if you were a tire shop or a donut shop. So that's something else to consider. You may not be seeing the full picture of what folks are saying out there, but you're going to have the skewed picture also. So there's a lot to consider with the Google reviews, but it does feel odd to see Google reviews for doctors. A little bit more expected to see it perhaps for a facility like a doctor's office or a hospital or an imaging facility. Maybe that might make more sense, but for an actual person who's a physician, yeah, that might be a little strange, but that's why you might see it. So that's something to take into consideration, and also know how it may or may not be curated. I'll just put it like that.
Versus actual patient experiences. So you're still kind of left with, you know, that wonder, how good is this doctor really? And then when you go to the more traditional ones, like the find a doctor types of tools, well, you don't see that many reviews on there and how many patients are really using that. So the traditional way that people would do it, you would get those big surveys in the mail. And the problem with that is, you know, how many patients really fill those out? Well, those have kind of gone by the wayside a little bit, unfortunately. Patients would fill them out, but they're just not quite as common as they used to be. And a lot of times those went straight to the health system, and the only way to really share them is if you had permission to share that information. You know what I mean? It's not the same as like somebody going straight to Google and typing up something themselves, like a Yelp review or something.
So the difference there is that's Press Ganey. If you've gone to a health system that uses Press Ganey, it's rather expensive. So not all health systems or doctor's offices use it, but that was rather the gold standard. And you could share patient comments, of course, without any identifiable information in it. And of course, you're only going to share the good comments, not the bad ones. But you could also look at an office's or a physician's Press Ganey scores. So you could feel pretty legitimate about what you were seeing there as an aggregate, because as an aggregate, what was shared there would be, you know, there wouldn't be any identifiable information included, and Press Ganey would share that. But yeah, that's become a little bit less common because of all these other tools. Oh, and I should say that, oddly, Castle Connolly has been making a bit of a play in this market. Epic is also, you may not realize this, but Epic is, let's see, I'm not going to use the word monopoly, but I'll just say it's a majority share of the patient record, the electronic patient record, electronic health record. And they have a Find a Doctor tool. And there are maybe some ways that people are finding physicians or looking at physicians, you know, using that, what they call theirs, Doctor Finder. So we put it Doctor Finder. So there might be some other things that you might be able to see if you're using, I think it's called My Chart, which is fairly common. So, but anyway, let's keep going, and you'll see some other things that will help you here. But yeah.
So finding ways to pick a provider that are reliable, aside from obviously talking to people you know, asking your physician who's the best one and why, going to meet the physician in advance to kind of have a consult, and then go with your gut, see how the practice operates, maybe a family member has had a procedure done by a specialist, something like that. At this point, those are really the most reliable ways to go about it. There are some online ways, just like you do everything else with the Google reviews coming up, but again, they're still a little bit sketchy. US News and World Report is still pretty reliable because the way they aggregate their data is actually coming from the physician's peers and things like that, and there's a pretty comprehensive way that they do it. But overall, the other ones are there's still a good bit of marketing involved, so you just have to be mindful about that. So the best thing to do is, and again, it's really difficult if you've waited 6 months for an appointment, you get in there and then you're disappointed with the result, then you're kind of back to ground zero. You want to avoid that part. So as much research as you can do ahead of time, you can look up the physician, the things that you can know, the basics at least. You can look up their training. There are tools almost anywhere. You can look the physician's biography from their past positions. You can look up where they trained, where they landed in different health systems where they worked previously, what their education looks like, pick up what their credentials are, what their fellowships look like, anything they're board certified in, things like that. And then you can start to piece all of these things together. You can start to, if you can find videos of this physician, look at their research. Those are the types of things you can see what their interests are, what their expertise areas are. Then you can start to build your own profile about what this physician might be like based on the need that you have, why you're going to see this doctor. Really, before you actually meet the provider. And then of course you'll get some of the experience about how organized the office is when you're trying to call, make the appointments, get your authorizations in order, those types of things. You'll see if they're really together. Do they answer the phone? Do they return your messages? Because if they don't, for instance, and you know you're going to have surgery, that may not be a direction that you want to go. So these are some of the things that you can do to kind of give yourself a heads up about whether or not this is a practice you want to be a part of.
That can be a real problem too. I remember I had to have a surgery once, and I called to make the follow-up appointment after I met with the doctor. I liked the doctor, couldn't even get anyone on the phone to make the follow-up appointment about the surgery. And I thought, this is a major surgery. I'm not going here. I can't get anyone to even call me back. So that was one thing that really changed my mind. And I ended up with a fantastic surgeon and experience. And I was really fortunate in that way. And I also had, oh gosh, I had one that was, this was in the center of excellence for the state that I was living in Florida. And so they had just had a surgeon for this particular condition I had come into their practice, and my oncologist was so excited about it. And so I went to meet with the doctor. It took maybe a month or two to see him. He never even examined me. And at this point, I had been in 2 prestige systems to be monitored, and I really wanted to be considered for, as a surgical candidate. And the surgeon came in and never even examined me and basically asked me something like, well, have you seen a psychiatrist? And I was like, wait, what? I've been in monitor surveillance status for a while. I wanted to see if I was a surgery candidate. What a weird experience. And then I was like, basically, I think it was like questioning whether I even had the condition when it had been diagnosed at the second top to the top institution. And then I was sent to be surveilled in the top, like the founding institution for my condition. It was a really strange experience. And again, the center of excellence. So you never know what you're going to get, even if you waited for the appointment, even if you've been you just don't know who's going to walk into the room, even if your own doctor has referred you to that person. And so I'll just have to say, and then the next thing that happened was, and like I said, this had been my oncologist, just regular follow-up stuff for a few years. And then they misscheduled my mammogram. And it was the first one I'd missed since I was 28 years old. I never missed my mammogram. And look, I've got triple negative breast cancer. Because they had sent a note and said, oh, because I called them and I said, I fly in on this date and you scheduled it on this. It was weird. And and then I ended up with triple negative breast cancer. So, I mean, it was a lot of mistakes for the state's center of excellence. You see what I mean? So, even the top places can start making mistakes. I never went back. I never went back there. I just was thinking that was a lot of boo-boos that were they were life-threatening boo-boos, and they were simple mistakes. Even when I would call, I'm on top of my stuff. I'm organized. So yeah, you start to get a feel for when mistakes are being made. Um, and when you have an experience like that with somebody who comes in and questions all the other experts, I'm like, well, what makes you different? I just wanted a surgical consult, and you basically questioned everybody else's expertise and look and made me feel about this tall. It was really strange. And yeah, it was just not good. So everything about that was like, okay, I don't know how you earned this designation, but not all designations are correct. And they might be great with other conditions, but my estimation of them fell pretty hard. Um, and I don't dox anybody, so I'm not going to say any of those things, but you see what I mean. You will find out and you will know. Your gut will tell you things and your experience will tell you things. And if they are telling you things, don't doubt yourself. Keep notes. And I was not even alone in that room. So yeah, it was definitely, you know, a surprise. Let's see. Oh, yeah, and the other thing about the misscheduled mammogram is I got a follow-up letter from it that mentioned something, and for instance, like, I have a lymph node that they always watch, and the letter didn't specify about, "Oh, yes, there's something that we wanted to watch." Well, had it, communicated specifically which side? Because 'cause I'm used to that. There's one lymph node they always watch. They didn't specify which side it was. Had they done that, I would have known this is something different and I need to even do this sooner than just, you know, this misscheduled. I need to do this like tomorrow. So do you see what I mean? The communication from the office needs to be very good also. Um, and I remember, sometimes I would have things say like, "Oh yeah, no problem, no problem." I'm like, "No, it is a problem. No, this needs to be sorted out immediately." So sometimes the office staff doesn't always know either. So you as a patient needs to tell the office staff, "No, this is an issue. It needs to be followed up on, blah, blah, blah." So you have to be that person also. Um, so there's that. And when I get that question a lot about the lymphoma. I've talked about that before, that it was a 25-year-old nurse practitioner who diagnosed lymphoma after a 5-year journey. Nobody could figure it out. So she was kind of new to practice. And so you never know who's going to be the person that's going to solve your issues either when no one else can do it. It's just coincidence sometimes. Somebody who hears the right thing and puts your puzzle pieces together, because I was presenting a little bit non-traditionally. So there you have it. So whenever you have something happening, you're trying to choose someone to either do your procedure, manage your condition, or you're trying to pick an office that's very, organized. All of those things matter. It's not just the expert who's going to work on your health itself, especially when it's a surgeon. You are basically letting them operate on your body. You want them to be great, but you want everyone who's supporting your care to be great also. Because if they're falling down or not organized, that is a problem as well. So, yep, make sure that you pick your provider and their support staff very well. So I want to take a second now and show you really quickly, see if I can get this. I'm going to show you a little bit about what some of these look like. Here is your U.S. News and World Report. This is Health U.S. News Cardiologist. I just picked one in Cleveland, Ohio, Heart Doctors. Now, the reason I picked heart doctors is because heart doctors, you think cardiologists, they do everything. Well, no, they don't. And this is true for endocrinologists. This is true for oncologists. If you look here, after cardiology, that's the general specialty here. you can see that they have very specific interests. They have, here's Dr. Falick has adult congenital heart disease. She has electrophysiology, and then she has heart failure and transplantation. It also shows you some things about whether she practices at a best hospital, which has to do with where she has privileges. And it also says patient's top choice, which probably means she has a really good bedside manner. Sometimes that matters to people, sometimes it doesn't. Come down here to the next one, Dr. Rovner. Just coincidence, and there's no picking anybody in here, but you can see that he has a focus on adult congenital heart disease, nuclear cardiology, cardiothoracic imaging, non-invasive cardiology, and then his special interest in coronary disease, hypertension. You can also see, oh, here's another one, electrophysiology. So he's got pacemaker. So you know that he's more focused on the, like if you have things to do with the rhythm of your heart, things like that. You can see, you also see that U.S. News and U.S. News and World Report, let me say it, talks about, and there are reviews in here too, like he's got 16, he's got 66. You can see that it talks about patients recommend him, listens, explains, performs through thorough exams, different things like that. So you can see different things, you can filter things out in here. But I wanted to point out that just because you need to see an endocrinologist, for example, you can also, endocrinology is a massive specialty, and it's a very in-demand specialty because diabetes falls under that one, but they are very varied in what types of things that they do. Same with cardiology, like you'll see here, see when you get down to Dr. I'm gonna say Cater, she caters to things that are, like you can see here, she's probably she would be someone who doesn't do any cutting. She's way more focused on heart health, and less, she does not do much with anyway, if you've got rhythm issues, things like that, you're probably going to want to skip on down the cough, things like that. So you've got different things you can look for. Oh, like see this one. If you're a tacky patient right there, so you can start to narrow it down by what their special interests are, what their clinical interests are, what they specialize in. And then if you look over here to the right, you can see there is a lot you can filter down to make sure you're finding the right person. Yeah, you can do by insurance and all that stuff. It might not necessarily be as up to date. You probably have a little bit more luck over here. It's barely up to date. You can also go, now we can talk about marketing, those best doctors in the magazines, things like that. Some of those are bought and paid for. Very commonly they are. So this one's a little bit less so, only because, as I mentioned, you have to have some endorsements by your peers to get onto this list. And so let's go to, let's also talk about experience. So as you start to notice, you see 21 plus years of experience. There is something to be said for folks with a lot of experience and some who are newly trained. People have different opinions about that and what might be appealing about them. Whether you've had the most recent, condition advancements or techniques, you're also going to be learning underneath, in your residency and your fellowship training, you're going to be learning from these folks. If you're in an academic center, my guess is where this best hospital is that they're all practicing at. And then some of these, you could pick by which hospital you want to go to. There's that option. Intermittent bracing heartbeat. So some of these things you can really narrow it down. And then some of that is just by preference. Then you can also look by, let's go to PubMed for a second. Let's say you want something, say you've got a really rare condition and you want somebody who's got some, I'm going to go with a weird one. So say you go to PubMed. Oh, come on. PubMed official site. PubMed is your National Library of Medicine. Say you have, see, esophagitis, that's just a weird one. So say you want to find a physician, or you have a physician you're looking at and you want to see if they've published research on eosinophilic esophagitis. So you can go into PubMed and find out what's been published in here, or you can go into PubMed and find a physician who has a lot of articles about this. Like, oh, hey, look at this person. I wonder if they're just a physician researcher or just a researcher. And hey, where do they practice and where could I go? See, you can look at, hey, look at this person. Who is this person? And hey, how do I find more about this doctor? And see, you could say, oh, okay, well, they're in the Middle East, so maybe not so much. You can go into other rabbit holes to find out more about that. And you could go to, so PubMed is a great place to go after you've figured out which doctor you want to see, or you could go to, let's see, clinicaltrials.gov. There we go. You could find out where clinical trials are happening, so you can focus your search and see what's going on and who's running them. You can do that anyway if you have a condition. But so there are a lot of different ways to find out about what doctors are doing if you have a really rare or really, say, difficult to treat condition or things like that. So there's that. There's also Doximity. Doximity is technically more about, I think it's really more for the doctors. But you never know. Sometimes you can find stuff there. Doximity is the, it's more for the doctors, but sometimes you can find things about the doctors that you're trying to look up. So let's see, if you wanted to go to like that Kaufman doctor and see a little bit more about them, then you could look them up in here. And then let's see, if you wanted to go to, where's the Google one? I'm going to just show Google with a closed doctor. So you like find your profile. Here are the doctor profiles. Let's go. Oh, let's not like that. We don't want to find me. Oh yeah, and you can go by NPI. That's your provider number. So if you have a doctor, you could go to, I don't want to dox anybody, but yeah. So Doximity is a way you can also find physician profiles on there. It doesn't tell you as much, but it does tell you some of those things you might want to know, like where they trained and what their types of training were. So it does help you. And then, like I said, Google, that's kind of weird, but it'll tell you things like their research, education, where they graduated from, the amount of experience they have, different things like that. I do kind of think of finding a provider as like dating. You are trying to find your perfect match, and it's going to be a pretty intimate experience in some ways. So it's like dating. It's difficult to do. And there's a lot to think about, a lot that you need to consider. And you want to know, like I said, if you care about the best or you care about convenience, you've got to decide what's most important to you. And then if you want to get it covered, then you go into the prior authorizations. So there's a lot. But those are the types of things that you can look for, and the types of things you might want to consider depending on what your issue is, what your condition is, what your, as far as finding a primary care person, sometimes you just have to accept what you are given. as a primary care doctor out the gate at the beginning of the year, and then find one that's accepting patients and switch. That has happened in some cases, just to make sure you've got one that's on the books, and then you go from there, because they are definitely difficult to get. And if you want to switch to concierge primary care, what you can do, it can't be paid for with your FSA or HSA card, but you can submit it as an expense after the fact. So you might have to pay it up front, but it is eligible. That fee is eligible for FSA or HSA reimbursement. So just FYI, if you decide to go that route and you want to go that route. And it does cover a little bit more extra, what's it called? Like you get more annual physical type stuff, like with mine, I get extra Cleveland Clinic heart evaluations. I get more, like a way more comprehensive annual physical. And of course, with, the cancer stuff that I've had going on, it's been a blessing. I'll have to say it that way. It's a blessing I pay for, but it's been very necessary. And I don't know where I'd be without the primary care that I've had the past 2 years. It's been phenomenal, and it's gotten me through some really difficult times. I don't know where I'd be. It certainly has saved money too. I haven't had to go to the emergency room. I think I've only had to go to urgent care maybe once or twice, and only because I needed somebody to look at my ear, and I wasn't in town where my doctor was at the time. It was only for that reason. Otherwise, no. So there are considerations if you want to do that math. But it's not like on TV where they come to your house or anything like that. But you can do telehealth late at night or whatever if you had to. So it's concierge in some ways, but it's not quite as fancy as all that. So that would be worth a consideration. I think those are the main points as far as, provider. And level. And then DO versus MD. The DO at the end of a name, Doctor of Osteopathy. The main thing there, that is, they're so comparable. And the DO, you've started seeing it a lot more. I actually was going to a primary care practice for a while that was training DOs instead of MDs to be primary care. And the thing I would say about that, personally, I like that because I do have a spinal fusion. So they have, it's not really that different, other than they do believe in doing, in fact, I'll show you a little bit about that. And I'll come back to that last bit of video in just a second. But let's see, there's one training school that I like a lot. I've seen it on a number of different, let me see here. It really wants me to, of course, in DoorDash. I'm trying to, the musculoskeletal system, but there's a word for it. Can't think of what that word is. The it's the OMT. That's it. Osteopathic manipulative treatment, OMT. So they do this musculoskeletal manipulation, and look, I'm going to show it's from Wikipedia, but it is correct. So see, I'm checking my sources. Make sure you check your sources. So what that does is it's basically a way. That was such a fun case. I remember one time they had all the trainees come in and listen because they were listening to my belly when they were doing an OMT manipulation, like up here, and they were listening to my belly at how it sounded because of the way the muscles were interacting in my musculoskeletal system. You could hear it because of the way, in my case, like the way my rib cage is a little bit actually, I'll say out of whack. That's not very clinical, but that's what it was. And it still is sometimes. I have these unusual rib attachments that sometimes, I don't have scoliosis or anything like that, but, it's because I'm on the computer a lot, probably. Who knows? But it's just a little bit, and I've known that since 2008. That's a little bit out of alignment. And because of the spinal fusion, I don't have any curvature in my neck. So it did make for some curious musculoskeletal reactions when they were doing the OMT, which OMT is almost, it's probably closest to like a chiropractic, not adjustment or anything, but like a manipulation of your muscles to release tension and make, the body try to heal itself. It sounds a little bit hippy dippy-ish, but it's not actually. I think it makes a lot of sense. It's just how everything works together and needs to be, in harmony. But yeah, that's what a DO does. But most doctors that you see who have the DO in their name just practice just like a regular MD, but they're just trained to know how to help your muscles. Like right now, like I'm like, oh, I'm so tired. They would know how to fix it. So I think it's really interesting, and I prefer a DO if they never do any OMT treatment to you. But if you needed it, they could do it. So that's the difference between an MD and a DO. Really, not that much. They're almost exactly the same. And so there is that. So if you're picking a provider and you see DO, don't worry about that. I would not worry about that at all. I don't find any preference there needed. But if you're in any way hesitant about it, look into it a little bit more and, get a little bit more knowledge for yourself. And I think you'll be reassured. It's not really any different. In fact, I think it's, like I said, preferable for me, but let's see. The only other thing I think I might consider is bedside manner. We really didn't talk about that too much. And just know that if, you're seeing a surgeon, sometimes they're a little bit more hands off, a little bit more disconnected, and that could be a good thing. That could be a bad thing. If you really want the interaction, you may want to, you might have to try a little bit harder to find someone. Oh, no, there is one other thing about surgeons these days. Really got to mention this. Is super important. If you're going to have a surgery, you need to ask your surgeon what their philosophy on pain control is. If you're going to have a surgery, you need to know if your surgeon is anti-opioid, because right now there are surgeons that are saying they will not prescribe post-surgical pain control, and besides like Tylenol and Advil and ice. So you need to know if you're having a major surgery. Personally, I will not choose a surgeon that is anti-opioid. I've had enough surgeries in my life. I do not care to suffer. Like I said, I've had a spinal fusion. Certainly had a few cancer surgeries, a few shoulder surgeries, things like that, a few dental surgeries. No, I don't care for that. I would rather have my pain nicely controlled. Wow. So no, that is a trend that you definitely need to ask if you're picking a surgeon what their thinking is on that. And I don't think that there is a replacement for that. Personally, having been through a number of them, there is not. You can make whatever decision you like. Again, I don't give medical advice, but I do think you need to have that conversation, and it needs to be in your hand before you have the procedure. Because you don't want to be trying to get home and trying to wrangle with the pharmacist about it, because you might run into a pharmacist that has that same philosophy or a different, whatever. Yeah, don't play around with that, because you don't want to find yourself in that position. And that is something that's happening in America right now. And it is kind of unbelievable, especially as a cancer patient, the things I've had to deal with in this realm this time around versus when I had the Hodgkin's in 2006. Oh my gosh, it's been quite shocking. So no, that's the other thing you definitely need to ask. And if it's important to you, and it should be, by the way, it's a big question you need to have on the table. And anyone who's come to me with questions about surgeries, I have definitely brought that up. Oh my gosh. So I think that's mainly it. Those are the ways you can put together a picture of who your provider is. And I'm saying provider because I'm including your advanced practice providers. That means your nurse practitioners, your APRNs, your NPs, your ARNs. It depends on what state you're in, how they're, and then your physician associates, your doctors, your MDs, your doctors, your DOs. They're the same as far as that goes. Those are both Dr. Blank, Dr. Smith. So that's who we're talking about. All your specialists, all your primary care. So that's why I'm using the word provider, because I mean all of those. And then I do have a preference on physical therapists too. I do prefer a doctor of physical therapy, a DPT versus, no offense to anybody who's a good physical therapist. If I can find a good physical therapist, I'll take them. But generally speaking, I found the DPT to be a little bit more, just because I'm a whole mess, but that's just me. So that's my take on that. And beyond that, acronym salad, I know there's a lot of it, but hopefully this will give you a little bit of direction on where to look to actually find information on preferred training, preferred credentials. Yes, there are credentialing bodies, and there are credentialing bodies at every hospital, practice, anyone who's doing hiring, all these things get vetted. Yeah, you hear those occasional anomalous stories of somebody practicing without a license, things like that. But there are bodies in every state. There are bodies at the federal level, the international, all of that. So, and you saw that little NPI number. Those NPI numbers are available to validate on most physician profiles. Yes, Google has become a thing for doctors. Not really quite sure how I feel about that yet, just because they can be a little bit more manipulated. Same with the best of. There are some good doctors and best doctors lists that are less up for purchase. And Castle Connolly coming up they're really doing their best to try to make themselves a little bit more of a legitimate choice, but that still remains to be seen a little bit. They're not quite there yet. And that's no shade to them. It's just they're trying to make themselves more, that just takes time because they've been around a long time. You've probably heard of Castle Conley before. They used to do the who's who list, stuff like that. So anyway, well, let's see.
When you actually meet the provider, there are other things to consider. We'll talk about different types of specialists and what that might look like as far as things to, as far as what your insurance might cover, might not cover, and what types of things you can look out for that might make you feel more comfortable or not comfortable as a patient. But for now, as far as initially choosing a provider, those are some of the things you can do as far as what's available tool-wise today to get you started at the very least. And then some of the things that are gatekeepers and that, aside from obviously you've got to be a licensed practitioner, and you can check licensing and credentialing, and there are sites for that for you to make sure your doctor is legitimate, because most of them are not going to practice without it. They won't last too long. People are going to report them, of course, but anything you want to check on, you can look those things up, and so those sites are available obviously on the internet. So at least there's some places to get started. Ask your friends, ask your family, start with experience, and then do your research. So there are a few things to get you started. It's not easy though. There's no one central place to really go and say, this one's the best. No, it's really not that simple, like anything in healthcare these days, unfortunately. But there are some additional ways to start building a profile. Then your comfort level will start to increase. Or maybe you start going in a different direction. You'll see a name that pops up next to theirs, and that will send you down a different pathway. And maybe that's the thing that helps you find some other experts that might be the right one for you. So good luck. So go on out there, get some good medicine, and give some good medicine.
So yeah, still pretty much everything held. There were a few things that I added to it that I thought it was good to expand upon that have changed a little bit. And I did get the chance to point out when the AI returned some results. You could see one was Wikipedia, and it's shocking how often Wikipedia is still returning in healthcare answers. So check your sources when you're getting results. Keep in mind what results can be manipulated, and that will help you. And also, if you're looking for something that is a health system you might want to pick, as I pointed out, just because something is prestige or has a big badge on it doesn't mean it's the best. I learned that pretty early on, and I learned that again 2 years ago. Oh my. So I've had some experiences with prestige systems, and then I've had some prestige systems bail me the heck out. So, that goes both ways. It's different, and that could be depending on, the condition. It could be depending on who the actual provider is, or it could be, the person who's at the front desk answering and coordinating everything. It matters. So go with your experience, like right out of the gate when you make the first phone call. Go with your experience when you have your first visit or try to schedule an appointment. Those experiences matter because they're going to carry through to the end, and know what, you're comfortable with and what you're not. So, yeah. So hopefully this will give you some idea about, and hey, if you just want to, you can do that too, because your insurance company they're doing some vetting anyway. If somebody's really bad, they're hopefully going to kick them out of their books. But you can't count on that. You got to count on yourself. You're your best advocate. We always say that here. So go out there and get some good medicine and give some good medicine. Good luck.